So we often hear the term ADD, or attention deficit disorder, but as a medical condition, that term has not existed since 1994. Young children especially exhibit those characteristics. They are impulsive and they are unfocused and they do have difficulty following directions.
After struggling in classrooms across Chicago with little positive results, I went back to school and took a position teaching children with varied learning disabilities to better understand the problems and to hone the solutions.
So when we think about this bell-shaped curve of attention, I think of children falling in that always category. They're really always paying attention and they're kind of chugging along and doing really well. Then we have the never, and those are the children that really, really struggle with their attention and their impulsivity. It's pretty obvious. And then I think of the sometimes category, which is that kind of average section, especially the kids who are maybe on the lower end of average for their attention span. They may not technically have ADHD or really deserve a diagnosis, but that doesn't mean they don't struggle with their attention, and it doesn't mean that they don't benefit from a little extra help and support when it comes to focus and organization. Now technically, only 4 to 6% of the population is diagnosed with ADHD. So those are the kids, when we think about our attention spectrum, that 4 to 6% are the kids that really struggle with their attention and their activity level and their impulsivity. But then you have a lot of other children who are kind of beyond that, but they still really struggle. So those children often benefit from some support and some guidance and some coaching from teachers and parents. I definitely had a student several years ago who had ADHD and had the inattentive subtype diagnosis. And she went probably several years before anyone ever really noticing that she had trouble with focus. I think she was in 6th grade by the time she got a diagnosis. And the diagnosis took a while because she wasn't causing a ruckus in class and wasn't kind of the poster child of ADHD. She would sit and look like she was paying attention and listening, but she was really just daydreaming the whole time. And it started to show up as the years went on that she'd have these gaping holes in her knowledge in math or in science and social studies, and she would just have these things that she had supposedly learned, or she'd at least been exposed to, but she hadn't really been paying attention, so all that information never really got filed away in her memory very well. And years went on and she had these gaping holes in her knowledge base, and it was really because of her lack of focus. So it was tricky to go back and work with her and kind of take inventory as to what stuff she had totally checked out on and missed out on in the past few years in school. Within the diagnosis of ADHD, there are 3 subtypes. The first subtype is the inattentive subtype. So children or adults who are diagnosed with ADHD, the inattentive subtype, would have characteristics like having difficulty paying attention to detail, making careless mistakes, having a hard time following through with tasks or assignments, difficulty with organization, and they tend to be easily distracted and forgetful. Now, as a teacher, these are children that you often don't know have difficulty with their attention because they're not squirming in their seat or wiggling or getting up or yelling out. They're sitting there and they're polite and they seem to be paying attention, but they're really not. They can be daydreaming or kind of checked out. So these are the kids that tend to fall between the cracks, especially in the classroom. The biggest strategy for her, she really benefited from talk a lot about, on a scale 1 to 10, is your engine revved up and running at a 10 right now, or are you at a 1? 1 being really low and you're kind of sluggish and spaced out. And so that kind of scale of 1 to 10 helped her monitor her own attention. And then she learned some strategies that if she was kind of checked out or her energy was low and her focus was low, she would get up and go get a drink of water. And we had to do a lot of work around when is that appropriate. Your teacher's in the middle of talking or in the middle of a lecture or teaching something. You can't just get up and go get a drink of water. So we worked a lot about how to take those kind of movement breaks and have it be appropriate and not get in trouble. But she would stand up and physically move. She would go across the room and get a tissue or walk down the hall just to physically move around. And that really helped her when she came back to her seat. She was often refocused just from moving around. If you liked this video and found it helpful, please leave a comment, like it, share it, head over to our YouTube channel and subscribe, as well as head over to learningdecoded.com and sign up for our weekly newsletter.